record.
Hi all. So myself and Jess are today going to tell you about how we delivered a user-centered NHS virtual visit from my perspective at Kettering, but Jess worked with some London hospitals. So, and you can see our Twitter handles there. So let's take us back a little bit to April. It was the start of COVID, but actually we hit that start pretty hard. And imagine at that time in April, you're struggling to breathe. You're taken to hospital, maybe blue lighted in. Your personal items are taken away. You're frightened and then told you can't see your family. You're admitted to intensive care, your condition quickly deteriorates, and suddenly you're scared of dying. But you're not allowed to see a loved one. No one can be there to hold your hand. No one can say goodbye, and no one say, I love you. This was a reality in many hospitals at the time. And the COVID pandemic caused all hospital visiting to be cancelled. Patients felt stuck. They couldn't see their loved ones. The harsh reality is they were dying without seeing their family, not being able to say goodbye. Wards were locked down. Staff were overwhelmed. They were physically drained for wearing PPE. They couldn't give the care they'd normally give. The burden on them in terms of psychologically and emotionally was significant. What could we do to help in that situation? Well, this is a story about how we tried to help by introducing a virtual visiting solution. That would allow patients to talk to loved ones anywhere in the world at no additional cost to them or the hospital. That had no privacy or information governance issues that commercial services might have had, and that safeguarded that contact and did justice to the high ideals of the NHS. So what did we do, or what did Madetech do in that time in April? In 48 hours, they built an alpha to get something into the hands of users quickly. This was in response to a tweet from Sonia Patel, and they did it in the right way. It was open source from the beginning. It used the NHS Digital Service Manual. It was focused on user needs with up to hourly feedback cycles from staff members on the front line. And it was rolled out into multiple wards in London, then multiple hospitals and multiple trusts, which is where we came in at Kettering. So what did we achieve? So in terms of technology, it's open source. If you check it out on GitHub, you'll be able to find it. It used video technology to enable a call between patient and loved ones. It was done in 48 hours. It was user-led from the start, and so far we've had 8,000, well, more than 8,000 video calls. The average is 1 hour, so significant call, and we're trending at 40 visits per day 6 months after launch. So I've mentioned it's rolled out into multiple hospitals, multiple wards, and it meant actually new ways of working for IT and frontline staff. And happy users, that's a real photo of an NHS staff member actually using the service in real time. So we're going to be brave now and do a live demo, or when I say I am, Jess's. So over to you, Jess.
Thanks, Ian. If I share my screen, we should be able to see this. So imagine yourself as a frontline NHS staff member. Perhaps you're a nurse on a ward. You have your iPad or similar device, and you're wondering which patients need to have virtual visits today. So you log into NHS Book a Virtual Visit, and you log in as your specific ward. You're then greeted with a very easy to see list screen. So you can see here that George Clooney is having a call with Britney Spears quite soon today. That should be a great conversation. And this allows the NHS staff member on the front line to be able to plan their day and be able to plan patient visits. So let's run through really quickly how to book a virtual visit. So you start by tapping Book a Virtual Visit. Before booking a virtual visit, the NHS staff member is presented with a screen just to give them a heads up for the type of information which they might need to bring with them. So we'll click Start Now. They're then presented with a list screen here of some basic information that is required in order to book a virtual visit. So we'll just put me in here and Ian as the key contact. Next, we've integrated this service with the GovNotify central government service that sends all text messages, emails, and letters for the UK. We've chosen to integrate text messages and emails for this NHS Book a Virtual Visit service, as sending letters might be a bit too slow. So let's send an email to myself. We then get to choose the date of the visit. It defaults to today, and then the time, it defaults to 10 minutes in the future. This is based on real user feedback. We'll click continue. Next, the NHS staff member receives a check your answers screen. This is just to make sure that things such as the email address and the phone number are correct, and then they click book a virtual visit. After clicking that or tapping that on their iPad, what happens is it sends a notification via GovNotify to the recipient or the key contact, otherwise known as the patient's loved one, their family, their friends in which they want to contact. Based on user feedback, we've also allowed the NHS staff member to very quickly restart this loop again by adding a book another virtual visit functionality. This came from real user feedback on the front line, where we found out that most of the virtual visits are booked in the morning, just before or just after the doctor's rounds. So this allows an NHS staff member to have their iPad or similar device and very quickly go through all of the different steps, all of their different patients in front of them. We'll go now and just see that. So now we can see here that in 8 minutes time, we have a call with Jessica and Ian. We can start, edit, rebook, and cancel that visit. Again, the edit, rebook, and cancel functionalities are based on real user feedback. Say it's time for the call to happen between Jess and Ian, we'll click start. We're then presented with a screen that just asks the NHS staff member to check before handing over the device to the patient that the person who joins this call is indeed Ian in this case, and that they are able to correctly identify the person inside of the ward that they're meant to be talking to, in this case Jessica. Ian in this case would also be asked to confirm Jessica's date of birth, a very simple and small piece of information that the correct individual should know about the patient inside of the hospital. This is a way of us confirming that this is indeed the right person. After I click attend visit or tap attend visit on my iPad, it then launches Whereby, which is a video integration service that facilitates the one-on-one conversation between a patient and their family. GovNotify, the central government service, sends a second notification out to the key contact or the patient's loved ones that they want to speak to with a unique URL for them to join. And that is the very basic NHS Book a Virtual Visit. I'm now going to show you very quickly the admin console too. So if I log in as Kettering, this is the back office IT or the sort of administration side of the service. It gives us a very quick overview of what's happening within Kettering. So you can see that the average visit time is very high and the number of visits per day is increasing too. We can then drill down into the hospital themselves. In this example, Kettering General Hospital Trust has one hospital, but you can imagine a trust with multiple hospitals, listing them down here. We've added the ability to include survey URLs to check what the key contact or loved one's family joining thought about that call, and also a support URL to if a hospital perhaps has a specific PALS or patient liaison service. What we found by user feedback is that a lot of these conversations are very critical times, perhaps saying goodbye to their loved ones for the last time, and being able to direct them to any information or any help that the hospital might be able to provide is very helpful. So that's NHS Book a Virtual Visit. I'll hand back over to Ian now.
Thanks, Jess. That was great. So hopefully you can see my screen, which talks about the benefits we've found.
Yeah.
And so obviously it enhances emotional support and well-being of patients. It means they can keep their contact. It empowers them. They're in charge, working with staff on the ward. It improves their patient experience when they're in the hospital. We've had feedback that says so. And it enhances patient care. It's not just about physical well-being, it's about patient mental well-being. And as Jess demonstrated, you can book reoccurring calls, so folks know there's a plan in place. And I must give a shout out to the NHS Digital Service Manual. This was only possible because of the great work from the team from NHS Digital. And if you don't know about the service manual, hey, you should do. It was built on the work of the Government Digital Service, and it gives great guidance around content, around accessibility, and not least around building digital services for the NHS, reusing their patterns and codes, saving a whole bunch of time and making sure your service is fit for purpose. So what did we learn through this period? We learned lots. We need to continue to be able to deliver services rapidly, based on those patient needs, led by patients, not necessarily by software suppliers. We need to innovate, and for me that includes working with folks like Jess and Madetech, people who know digital, who get digital, who build things right. We need to join things up. And I say join things up rather than use interoperability and integration, because there's many systems in the NHS and they need to talk to each other to deliver what staff and patients need. And for me, that means building on national standards, coming from NHS Digital, NHSX, NHS England, but grow local skills. The kind of skills that trust me you've needed 5-10 years ago, I think are quite different in a digital world. And yeah, build on the best of breed across the NHS, including fantastic work like the NHS Digital Service Manual. And that's it from us. Thank you for your time. You have our contact details there. If you'd like to contact myself or Jess, we'd be more than happy to talk around the service. And that's bye for now.
Thank you.